it's really a general problem. It's not a problem only in Parkinson's disease. It's a big Asian genetic studies that, we have this Eurocentric approach where most populations that have been included in GWAS, I think more than 80% of all the individuals that have been included in large genetic studies, so genome-wide association studies, or GWAS as we call them, come from either the US or Europe, but mostly European populations. And there's a reason for that is the more homogeneous the population is, the easier it is to study it. So that made that some populations like Latinos that are very ethnic were always excluded from analysis, but there's also big populations like the African population or even Asia where, there's a large number of individuals that live in the world that are not really well represented and for which we don't know much about the genetic risk factors in this case for Parkinson's disease. But again, this really applies to most of diseases that have any genetic component. I think there's a lot of reasons for it. One of them is obviously that we want to make sure that the findings are applicable to every individual. And that is not the case when all the data comes from only one population. So that's one of the, we want to make sure that, we have equal opportunities to give the same care to everybody. But obviously from the scientific point of view, there's a lot to gain from including these underrepresented populations. There's a lot we can learn from them, especially in complex diseases like Parkinson's disease, where there's environmental and then a lot of genetic factors that influence the risk. It's not only one gene, it's not a single gene disease. It means that, your entire genome could have an effect of what your end risk is for Parkinson's disease. So including all these individuals really can give us some insight into all the genes that are participating in Parkinson's disease. So obviously that can be used to do better or identify new targets for therapy. But also it can help us, design for example, what genetic testing would be for different individuals from different populations. So, because there might be different genes affecting different populations, your approach to study those individuals or when that information gets used in the clinic the approach will be different depending on, who you have in front or where your patient comes from, ancestry wise. So I think it's very important for us to be able to learn more about what the similarities and also the differences between the different populations are, so we can, do better prediction again and really understand what are the most important genes that we should be looking for in each individual.